Thanks for coming to today's session on managing cancer-related fatigue. My name's Anthea from Occupational Therapy, and I've also got Celia here, who's an occupational therapist. So today we'll be discussing what is cancer fatigue, some common symptoms of fatigue, energy levels, some strategies, some resources that are available. And the session will also involve some group discussion. So feel free also to ask some questions as we go along, and we've also got some activities you can do personally or with a group as well. So cancer-related fatigue, so it means tiredness and lack of energy. So it's actually the most common side effect of cancer and its treatment. So as you probably know, it's different from everyday tiredness. And it can happen suddenly, so it can happen even if you haven't been doing exercise or had a long day, and lots of people say it fluctuates also. So cancer-related fatigue actually affects 70 to 90% of people with cancer, and I guess it fluctuates for everyone as well. So for some people it's side effects from treatment, for example chemotherapy, radiotherapy or surgery. And for others it's due to the symptoms caused by the cancer itself. So common fatigue symptoms include overwhelming tiredness, physical and mental fatigue. So it's not just fatigue from doing a strenuous activity physically. Some people often say they get fatigued from checking their emails or perhaps a phone call that might be quite stressful. So it's important to think of that as well, and thinking about fatigue and energy levels as well. Not being able to complete the things that you wish to do or you normally do, and like you said as well, needing to sleep more than usual, and perhaps activities you normally do might become harder as well, and usual energy levels that you do have decrease as well. So there's some common symptoms. So I've got these envelopes here, so just in terms of energy levels, so the larger envelope might be the energy levels that you feel when you're feeling better and you're feeling well, and the smaller ones is in terms of how you might be feeling when you're experiencing cancer-related fatigue. So as you can see, the larger envelope you can fit a few more things in during the day, and the smaller one, there's not as many things you can fit in during the day in terms of the energy levels. So things might be a bit more tiring, and you might find that you might schedule quite a few things in your day, but there's strategies in terms of ensuring you fit everything in terms of managing and your energy levels as well. So looking at what's realistic and how much can you actually tolerate during the day in terms of your energy and what tasks you do as well. So it might be about not bunching too much into the day, but looking at some strategies which we'll discuss later on, such as pacing and spreading your day out as well. So this is a good envelope sort of way to explain to people as well in terms of your fatigue. So it's a nice way to look how much energy you have and how much you can realistically fit in as well. So, and I think another thing, and especially if you're working or if you have people that call as well, there's often unexpected things that can arise. So it could be an unexpected phone call, it could be how you're feeling that certain day, and you need the energy to manage that as well. So it's important not to try and fit too much into the day, so you've got enough energy to cope with the unexpected as well. So it's sometimes good to divide your day into what do I need to do, but also how much energy it takes. So some tasks for you personally might be low energy, medium or high energy activities, and it's very dependent on yourself, and it might be different from your friend or family member as well. So it's important to consider your energy levels and the need to also include rest in your schedule. So they say it's important to actually schedule in rest breaks instead of stopping when you're completely tired as well. So and considering what you want to do, what you need to do, and what is a lesser priority, and spreading out perhaps the low, medium and high energy activities. So if you find during the day that when you look at what you have to do, and lots of them are high energy activities, look at could they be spread out during the week, or could they be done a different way to make them a lower energy activity. And looking at the smaller energy envelope, so when your energy levels aren't 100%, how much can you fit in during the day? and looking at establishing a regular routine as well. So, and Celia will move on to discuss more about prioritising and pacing and planning a day as well. So,
prioritising and delegating. So I'm sure everyone's probably got some similar experiences with this, but utilising family and friends to support you to get some of those tasks done that might be increasing your fatigue. So I guess something like cleaning that comes up, those heavier cleaning tasks, perhaps there's a supportive family member that can help with cleaning that bathroom out, or is it a matter of thinking about, could I organise a private cleaner to do that with the heavier tasks? And I guess it's still checking in with yourself, what's important that you want to keep doing for yourself. So some people might decide, I'm very house proud, I like things done a particular way, I'm not really willing to give that up. But I'm not such a fan on the cooking side of things, so maybe someone can take that and I've got more energy to keep going. So I think it's really tapping into what you're happy to maybe let go of and what you don't want to give away. And I think that prioritisation we're talking about, there might be things that are a must for you that you want to be able to get done through the day. So maybe picking the kids up from school, I guess, is pretty essential. So you'll make that a top priority, and then maybe mopping out that shower, maybe that can wait a couple of days, or if I hang up the washing, maybe I'll just hang it on the clothes horse rather than the washing line, because that's going to save me energy. So it's thinking about that list that you have, and I think generally all have lists during the day that we have these ideals of what we're going to achieve or through the week, but we don't always achieve 100% of those anyway, and I think it's maybe adapting that to this situation. And also the frequency that we do activities. It's looking at what maybe those standards that you had in terms of how frequently maybe you like to go to the shops, whether it's you could do it once a week and get online shopping the other day. Will that save a bit more energy? How often you're doing some of the cleaning tasks or the gardening tasks? And considering the frequency and how that will save you energy. Some people describe pacing as doing a little bit, having a rest, doing a little bit, having a rest. But it's also understanding the baseline of your activity. So when we talk about the baseline, it's around how long can you do one activity before you reach that point where you hit the wall when you're really fatigued. Before, almost when you've still got maybe 25% left in the tank, that should be the baseline that you're aiming for. So I guess for like socialising, you're saying 2 hours is your max. What would sit comfortably with you? Would it be an hour and a half, an hour and 45, or before you reach that crisis point? And it's understanding that really helps you pace through your day. And obviously that's going to change depending on what you've got on the day, depending how you're feeling with your treatment and symptoms. Maybe if you're sick, if you're even coming to Peter Mac for a whole morning of appointments too, that's going to change things as well. Again, thinking about that envelope analogy or the bank account analogy, do you have enough energy in that envelope to get through your day? And plan your day around your energy levels. So we're not busting open that envelope with lots of stuff, we're just wanting to use 75% of it. And again, like I said, that's really allowing your energy for those unexpected situations, a phone call or change in symptoms or unplanned visitor. Where possible, I think it has been quite effective for patients to do that. An easy thing also maybe to communicate with family a little bit too. It's another, these analogies of patients that are quite useful to be able to explain what's happening for them. Other strategies which we've talked about a little bit as we've gone along, but just to remind ourselves, it is important to schedule those rest breaks into your routine. So even if you went away today and looked at your daily routine and thought, where do those rest breaks sit? And do they break up those high energy and those medium energy activities? How long are they for? Yeah. And also think about your sleep as well. That's something I touched on too much here, but there is a sleep program the psychologists run here. So if you're having problems with sleep,
And if you're a menopausal woman on top of that.
Yeah, on top of that,
Yeah.
there's definitely, they've got some great resources there for you.
Yeah. So have a chat to your doctor if you're interested as well.
Yeah,
Make a referral.
Everyone's got multiple factors with sleep.
Yeah.
And it's important to have that. So, and think about the tools and equipment that you might use. So when I talk about that, it's everyday tools at home, whether you're using a stool in the shower or a perching stool in the kitchen to sit and cut those veggies for the roast chicken that you're doing. Whether it's think about the height of items regularly used in your kitchen, you're always going right down to the bottom in the back corner to get your saucepans out. Can I rearrange that so I'm not expelling so much energy? And exercise, like we've said, is also very effective to assist with improving your energy and cancer-related fatigue. So I think if you haven't had any advice with exercise and you're feeling like you'd like a bit more direction, I think it's worth asking for your doctor to be referred to the exercise physiologist. And they can give you a bit of a regime, and then just refer you out. It's only maybe 1 or 2 sessions, but just to get you going with a bit of a plan. Cognitive rehab, so that's mainly to deal with strategies to help you with your memory and your concentration that are affected by cognitive fatigue. So a lot of the studies show that it's the short-term memory and concentration are the main things people struggle with. And as OTs, we sometimes have one-on-one sessions with people and think about different ways of compensating for that. There's some retraining that you can retrain your brain a little bit, but there's also strategies like we're saying we can no longer multitask. We just have to think about chunks of information, chunks of tasks that we need to do. Yeah. So we can help people with that. And relaxation and stress management. So stress can still play a big part in the fatigue, and your mood can play a big part in the fatigue. So it's thinking about where relaxation and ways to deal with stress sit in your routine. That varies for everyone. Things like, I think there's some stress management courses here actually.
There's meditation in the Wellbeing Centre.
So sometimes it's a bit of try them all and see what fits, and build on that toolkit as well. So I think the take-home messages today, really, I think you've got a few little tools to take with you. It's a real snapshot of fatigue management. I probably haven't covered everything, but I think you get to take some key ideas home. Just keep thinking about your energy levels and when planning your tasks for the day and the week. So have a think about that for the next week, and think about that balance between activity and rest, and those levels of activity, low, medium, high, and always leaving that bit of energy left over for those unexpected priorities, and how you want to prioritise and delegate those activities. So in terms of resources, there's us, there's an OT department here, so you can always come and talk about personal strategies if you like, a couple of sessions referred through your doctor. Exercise physiologist we've mentioned, specific to your goals, you prescribe the exercise. There's also physio, dietetics, nutrition and psychology.
And just speak to your doctor if you think it might be useful, and then they can email the relevant therapist and let them know about the condition. And
we do run a clinic on a Thursday morning where you can come see all of these disciplines at once, which is quite handy.